Hi, my name is Arely Quintana, and this is my video. Today, I will be talking about stress management. First, let's define stress and management. According to Dattilo and McKenney, stress is an external force that produces strain on a structure. The external force is a stressor, and the strain it produces is stress. Stress is the perception that events or circumstances have challenged or exceeded a person's ability to cope. Management means to accomplish, to handle, to control. Together, the words stress and management mean to take control of the external force that is causing strain on you. There are two types of stress. Distress is bad stress that can produce emotional disturbances such as aggression or withdrawal, discomfort, and even disease, like hypertension and atherosclerosis. Eustress is positive stress that represents challenge for personal growth. Eustress can be created through recreational activities like snowboarding, rock climbing, and competitive sports. Such activities produce psychological arousal, leading to feelings of enjoyment, improved self-esteem, and competence. How long has stress existed? Since the days of cavemen. The stress response, aka flight or fight response, was necessary for survival against large predators. Although these days the threat of a saber-toothed attack is highly unlikely, our sympathetic nervous system continues to react to everyday stressors in the same manner. Stress will always exist. The purpose of stress management is not to rid one's life of stressors, but to learn how to control one's reaction to stressors. This can be achieved through many methods, such as meditation, Tai Chi, yoga, progressive relaxation, and biofeedback. I will now describe the effectiveness of stress management on three populations. According to Porter, populations with alcohol dependency can use stress management to help with coping and management. This was supported by two case studies conducted by Calajo in 1986. Both participants became addicted to alcohol because of feelings of stress and anxiety when sober. Both individuals use alcohol as a coping mechanism to relax in social situations. After a 6-month yoga program, both participants expressed increased levels of confidence and relaxation, higher degrees of comfort in social situations, and continued abstinence from alcohol. 1.5 years after the program, both individuals continued to abstain from alcohol, experienced improved quality of life, and continued the practice of yoga at least twice a week. Porter suggests the use of stress management to reduce stress in populations with intellectual disabilities. In 1989, Lindsay and colleagues administered individual behavioral relaxation training to 50 participants with moderate to severe intellectual disabilities. Anxiety was measured through pulse rate and observed behavioral anxiety of voice, trunk, head, eyes, lips, throat, shoulders, hands, feet, and general relaxation/tension. Results indicated significantly lower levels of anxiety compared to participants in a control group. Growing research supports the benefits of stress management on major depressive disorder by increasing ability to manage and cope with stressors. In a quasi-experimental design, Taylor Pally, Haskell, Waters, and Freilicher tested the effects of a 12-week Tai Chi program on 39 adults at risk for cardiovascular disease. Levels of depression, stress, tension, and anxiety were measured using the Perceived Stress Scale, Profile of Mood States, Multi-Dimensional Scale of Perceived Social Support, and Tai Chi Self-Efficacy Performance. 12 weeks of Tai Chi resulted in increased levels of mood state and self-efficacy, and perceived stress decreased significantly. Yoga is a gentle and effective form of stress management that can also provide physical benefits such as increased balance, flexibility, strength, and range of motion. I will now demonstrate how to plan and implement yoga to a person with multiple sclerosis. I will first show the non-adapted yoga posture, followed by the adapted yoga posture for multiple sclerosis. First, due to the decrease in heat tolerance in populations with multiple sclerosis, I will set the room temperature between 70 to 75 degrees and have an ice water nearby to prevent overheating. Most people with multiple sclerosis have difficulties with ambulation and balance, so I will provide a chair for a seated version of yoga. Since this chair has no padding, I will position a folded blanket over the seat and through the back to provide comfort and prevent sliding. Multiple sclerosis is characterized with blunted heart rate and reduced blood pressure. A heart monitor is recommended to check the client periodically and adjust the intensity of the activity if necessary. I will begin the activity with a Shitkari Pranayama breathing technique. This is a cooling breathing technique, affecting brain centers associated with biological drives and temperature regulation. Not only will this breathing practice cool down the body, but it will also reduce mental and emotional excitation. I will guide the client through the steps in the breathing practice. Sit in any comfortable meditation posture. Close the eyes and relax the whole body. Hold the teeth lightly together. Separate the lips, exposing the teeth. The tongue will be kept flat. Inhale slowly and deeply through the teeth. At the end of the inhalation, close the mouth. Exhale slowly through the nose in a controlled manner. This is one round that you will repeat for 15 to 20 minutes. We will now continue to the demonstration of yoga postures performed by Dave, my roommate. Dave will execute the non-adapted cobra pose or Bhujangasana variation 3 by lying on his belly on a yoga mat on the floor, placing his palms down on the floor next to chest. Legs are together, muscles gently activated. Inhaling, Dave will gently push his torso up to a degree that is comfortable, extending through the spine. Breathe and get quiet in the posture. Exhaling, release gently back to floor. Pause, breathe, and observe. Repeat. The second yoga pose is twist, or Supta Matsendrasana, variation 3. Dave will lie on his back with his left leg straight and his right knee bent. Extend your arms out at shoulder height, palms down, grounding through your shoulder blades. Inhaling, lengthen your spine. Exhaling, release your right knee to the left. Look right. Place your left hand on your right thigh. Breathe and get quiet in the posture. Inhaling, bring your head and knee back to center. Straighten your right leg and repeat on your left leg. The last yoga pose Dave will perform is mountain pose with overhead stretch, or Tadasana, variation 3. Dave will stand tall and straight. Root into his feet, rise up through his center. Feel your spine lifting out of your waist. Heart lifted and open. Shoulders soft, wide, and released from ears. Crown of head lifting with the neck long. Rest your arms at the sides of your body. Pause, breathe, and observe. With an inhale, gently, slowly, with awareness, raise your left arm overhead or as high as you're able to reach, reaching through your fingertips. Maintain your left arm up while exhaling and extend upward while inhaling. Lower arm gently with exhale. Repeat the sequence, raising the right arm. Repeat raising both arms if comfortable. Pause, breathe, and observe. Repeat if desired. Dave will now complete the same yoga poses using adaptations for multiple sclerosis. Cobra pose will be performed seated straight up in a chair with legs together. Reach your arms back to hold your hands on sides of chair. Inhaling, lengthen your spine, arch from your heart area, pull your shoulder blades together, and lengthen your neck. Breathe and get quiet in the posture. Exhaling, return to sitting up straight. The twist will be executed seated in chair. On an inhale, lengthen your spine. On the exhale, gently revolve your torso to one side using the chair seat and back for support with your hands. Breathe and get quiet in the posture. Pause, breathe, and observe. Repeat, turning the opposite way. Lastly, the mountain pose with overhead stretch will, surprise, be performed seated in a chair. Root into your sit bones and feet. Extend up through your spine. Feel your spine lifting from your waist, heart lifted and open. Shoulders soft, wide, and release down from ears, and crown of head lifting with neck long. Place hands on thighs or on seat sides to support spinal lift if needed. Pause, breathe, and observe. With an inhale, gently, slowly, with awareness, raise your left arm overhead or as high as you are able, reaching through your fingertips. Maintain your left arm up while exhaling and extend upward while inhaling. Lower your arm slowly with an exhale. Repeat the sequence, raising the right arm. Repeat raising both arms. Pause, breathe, and observe. Repeat if desired. And that is the end of our adapted yoga session with Dave, my roommate. Thank you, Dave.